Hello everyone, welcome to another video. In today's video we're going to be talking about tetanus. And in the last video we treated the condition known as pertussis, which is whooping cough. So today we'll be looking at another life-threatening infection, and basically this tetanus is an acute infection, and it is caused by a potent neurotoxin called tetanospasmin. So this tetanospasmin, it's produced by a particular bacteria. It is produced by the bacteria known as Clostridium tetani, which is an anaerobic and a spore-forming bacterium. So the condition is characterized by muscle stiffness, painful spasms, and autonomic dysfunction, and it typically follows contamination of wounds with the spores from the soil, from dust, or from animal feces. So tetanus remains a global public health concern, especially in low resource settings. So looking at the background, Clostridium tetani, like the spores of this Clostridium tetani, they are ubiquitous in the environment. So ubiquitous basically means they are everywhere, particularly in the soil, particularly in manure, rusty metal objects. And when they are introduced into the body, they are usually introduced through a break in the skin, especially when someone has a deep or necrotic wound, and the spores, they germinate under anaerobic conditions, releasing this tetanospasmin, which is the neurotoxin that causes tetanus. So the toxin, this tetanospasmin, it binds to peripheral motor neurons and travels retrograde to the CNS, and it blocks the release of inhibitory neurotransmitters like gamma aminobutyric acid and glycine, and this results in disinhibition of motor neurons and muscle hyperactivity. So basically this Clostridium tetani is everywhere. That's why whenever you have like a cut, or you have a wound from maybe a nail, you got it from a random stepping on a nail, or a scratch from a surface, it's usually recommended that you take tetanus injection, because you don't know where this Clostridium tetani might be inhibiting. So it could be anywhere, like you don't really know where they can stay. So it's better to have like prevention before you could get to any complications from this infection. So looking at the signs and symptoms, so symptoms usually appear 3 to 21 days after exposure. So they don't appear immediately. That's why most of the time it's better that you hit the nail on the head immediately it happens, because if you are like, oh, I'll be fine now, tetanus doesn't happen immediately. It takes 3 to 21 days after the exposure for you to start seeing symptoms. Most commonly, it usually occurs after around like 7 to 10 days after exposure, most commonly. So the severity increases with shorter incubation periods. So the key symptoms are: number one, trismus, which is known as lockjaw, and this is basically the inability to open the mouth fully. Like you won't be able to open your mouth fully. Then neck stiffness and difficulty swallowing would follow too. Then rigid abdominal and back muscles, often causing arching back, like an arching back known as opistotonus. Then painful generalized muscle spasms, especially triggered by stimuli like light, sound, touch. Then autonomic instability, that is fluctuations in blood pressure, fever, the presence of profuse sweating, and the presence of irregular heartbeats. Then there will also be respiratory distress from this due to the spasms of the larynx or the diaphragm, and seizures can also occur in very severe cases. So looking at the clinical presentation, patients may generally present with history of a recent wound, often minor or even unnoticed. Like we could even injure ourselves and we won't even know that we scratched, or less like most of the time is when you feel pain that you know you've injured, but sometimes pain might not even be there. So the patient might have a history of a recent wound, or like a recent wound that is minor, or the ones that they didn't even notice, and then muscle pain or rigidity starting in the jaw and descending, then spasm triggered by sensory stimuli, and then no loss of consciousness, as the tetanus affects the motor system, not the sensory system. Then the patient is usually unvaccinated or has unknown immunization status. So looking at the etiology, the causative agent is Clostridium tetani, and it produces the exotoxin tetanospasmin, which is the toxin that affects the neuromuscular transmission, leading to all the various symptoms. So anaerobic conditions is beneficial for this bacteria, and it allows the spores to germinate and toxins to be produced. So looking at the risk factors, number one, lack or incomplete tetanus immunization, then punctured wounds, crush injuries, burns, or having surgical wounds. And then also use of non-sterile instruments like doing traditional circumcision, tattoos, ear piercings. So using all these non-sterile instruments can lead to this infection. Then there could also be neonatal tetanus from unclean umbilical cord care. So when newborns are giving birth to and their umbilical cord is not cut properly, is not dressed properly, so it could lead to this condition. And then using of IV medications too is a risk factor. Then like constantly using IV medications. Then looking at the anatomy and the physiology, tetanospasmin affects the anterior horn cells and inhibitory interneurons in the spinal cord, and this prevents the release of gamma aminobutyric acid and glycine. And the result of this prevention of the release is the constant muscle contraction and spasms due to unstopped excitatory signals. So basically the toxin enters through the wound and binds to peripheral nerves. Then it travels through the axonal transport to the spinal cord and the brainstem. Then it blocks inhibitory neurotransmitter release, and this blockage causes spastic paralysis, rigidity, and muscle spasms. So usually recovery requires new axonal growth, as the effects of this tetanus are usually irreversible once the toxin binds. So looking at the diagnosis, clinical diagnosis is based on the history and symptoms. So there are no reliable lab tests to confirm tetanus. Investigations may include like wound cultures, which is often negative, then blood tests to rule out other conditions, and then electromyography, which may show sustained muscle activity without relaxation, so the constant muscle spasms. Then other conditions that could mirror the same symptoms as this tetanus, like seizure disorders, because we have, in severe cases of tetanus, we have seizures. Then meningitis too, rabies, and hypocalcemia, and also strychnine poison. So we could see these similar symptoms with tetanus in these infections too. Then for the approach considerations of how we can manage tetanus, for supportive care, in case we usually admit to the intensive care unit, and it's better for the patient to be placed in a dark or a quiet room to avoid stimulus that could, like sensory stimuli that could trigger the spasms. So when we monitor for respiratory and cardiac function too, and sometimes the patient may require intubation or ventilation in severe cases. So then we look at like the neutralization of unbound toxin. So how we do this neutralization, we use so there's something called human tetanus immunoglobulin. So it is given intramuscularly as soon as possible. Then intrathecal injection, it may be used in severe cases and is usually done by a specialist. So how we control the muscle spasms, we could give benzodiazepines like diazepam or midazolam. So these two, they are GABA agonists that help to reduce the muscle spasms and the anxiety. Then we could also give magnesium sulfate to reduce spasms and the autonomic dysfunction. Then neuromuscular blockers too, they can help, like vecuronium, especially in ventilated patients. Then some beta blockers can be used to control the sympathetic overactivity. So also we have to look at how we can eradicate the source of the infection. So we can do this by like giving antibiotics, but we could also do something called wound debridement. That is a way to eliminate anaerobic environment for the microorganisms, because if they are deprived of the condition in which they can grow sufficiently, is a good way to stop their production of their toxins. Then for the antibiotics that we could give metronidazole. Metronidazole is usually given first line 500 milligrams every 8 hours for 7 days. Then penicillin G is also effective, but it may worsen it may worsen the muscle spasms because it inhibits GABA. So when we're using antibiotics, we have to avoid using aminoglycosides and tetracyclines because they have a risk of neuromuscular blocking. Then also vaccination. Even after recovery, patients are not immune from tetanus, so it's better to start or complete the 3-dose tetanus toxoid containing vaccine series if the patient has not already taken it. So this is the best way to prevent this tetanus, by taking the tetanus toxoid vaccine. So depending on the prognosis, depends on the incubation period, the age of the patient, and the availability of the intensive care when the condition has become so complicated. So when there is a shorter incubation period, there is worse prognosis for the patient, and usually the fatality rate of tetanus is between 10 to 20%, even with treatment, and is higher in neonates and in the elderly. So usually survivors, they often recover fully, but recovery may take months. Like it usually is not a very short process or a quick process. So prevention is usually better than cure in this case of tetanus. Like routine childhood and adult tetanus vaccination is necessary, and necessary to have a booster dose every 10 years. And then also we have to look at proper wound care and prompt prophylaxis, especially in injuries, to prevent the entering of this bacteria into the exposed flesh. And then tetanus immunoglobulin too can be given in high risk wounds if the person's immunization history is incomplete. So that is basically the breakdown of this condition known as tetanus. So it's better we take the tetanus toxoid vaccine to prevent cases, to prevent complications from this tetanus, because mortality rate can reach like even 50 to 60% in resource limited settings, like places where they don't have enough resources to treat patients. And full recovery, like I said, it can take weeks to months due to the regeneration of the nerves. So vaccination is key, and tetanus toxoid is the best. It's taking tetanus toxoid is the best way we could protect our body from this particular bacterium. So that's basically it about tetanus. Thank you.